Hello, folks. Looks like we've got just a few folks on right now, but we are dialing out to tens of thousands of your fellow constituents in California's 33rd Congressional District. We'll be dialing out to over 85,000 households around California's 33rd Congressional over the next few minutes, and I'll tell you how you can participate in that live forum. It'll take about an hour, and you're welcome to submit questions for Q&A. We have a couple of guests on with us. We have your Congressman, Ted Lieu, representing you in the 33rd Congressional District of California. We also have a special expert guest, Dr. Sion Roy, cardiologist at Harbor UCLA Medical Center, president of LA County Medical Association, and trustee at Santa Monica College, here on the line with us as well to give us an update on the fight against COVID, along with current infection rates in the California's 33rd Congressional District. We'll be discussing that along with several other topics, though, so if you have any questions on any other subjects that are of interest to you that the Congressman can help to answer, any questions on Build Back Better, the Investment and Infrastructure Bill, any other concerns you have on the issues that affect you in California's 33rd Congressional District, press 0. Give your question to one of our operators, and they'll take down some notes. We'll gladly take your question live. If you're not comfortable asking your question live, you can feel free to let your operator know you prefer to have me read your question over the air instead. Whatever's more comfortable for you is fine with us. Again, 0 to submit a question for Q&A with Congressman Ted Lieu and with Dr. Sion Roy, who's on with us as our expert guest tonight. I'll give you a couple of quick notes, and then we'll go ahead and get started. If you're looking to get more information on the work the Congressman's doing in D.C., you can get that at lieu.house.gov. You can also contact the district office in L.A. at 323-651-1040. And if you'd like to get email updates from Congressman Lieu's office moving forward, you can press 7 on your phone right now. Give your best email address to one of our operators. They'll add you to the email update list, and we'll keep you updated better electronically moving forward. So once more, if you'd like to give us your email for email updates, you can press 7. Give your best email to an operator. We'll add you to that email update list. You can also go to lieu.house.gov and sign up for email updates there. One more note here, folks. If you did want to submit a question, we've got lots of folks joining us tonight. We're going to take questions on a wide variety of topics, so anything that you're interested in, you can feel free to press 0 to submit a question for Q&A. But we do have a special expert guest here to provide us an update on the fight against COVID, along with current infection rates in California's 33rd Congressional District, and to help answer your questions about COVID, Dr. Sion Roy. So if you have questions for him or for Congressman Lieu, press 0, give your question to an operator. They'll take some notes. We'll put you in line to ask your question live. But if you're not comfortable asking it live, let your operator know you want me to read it, and I'm happy to do that for you. One more time, 7 for emails, 0 to submit a question for Q&A. And it's my pleasure to kick off this live forum with California's 33rd Congressional District by turning it over to your Congressman, Ted Lieu. Representative, please go ahead.
Thank you so much. I want to thank everyone participating on this telephone town hall. It is an honor to represent you in Washington, D.C. I'm going to give you an update on some legislation that we have passed in Washington, D.C. with a focus on the infrastructure law. And then I'm going to give an update on the pandemic by having our great expert witness here with us, Dr. Roy, and he will provide you some important information about the Omicron variant. And then we're going to take any questions that you may have. So earlier this year, Congress passed the American Rescue Plan, and it had essentially 4 goals. It was to get shots in the arms, put kids back into schools, get people into jobs, and put cash in their pockets. It accomplished those 4 goals. Stimulus checks went out to people who were still recovering from the pandemic. We got kids back into schools full-time in person. With every passing day, more and more people are getting vaccinated. And since January 20th, we created over 5 million new jobs. At the same time, we realized that a lot of people lost a lot of jobs during this pandemic, and we needed to increase the number of jobs in America. So Congress also passed the infrastructure law. And that law is not only going to create good-paying jobs across the nation and also in California, but it's also going to help rebuild bridges, roads, and highways. It's going to put EV charging stations across our nation, and it's going to make sure that we are resilient to cyber attacks on our infrastructure. Specific to California, we're going to benefit in a big way. Here are just a few numbers. We're going to receive over $25 billion in California for federal highway programs. We're going to get $4.2 billion for bridge replacement and repairs, and we're going to get $9.45 billion for public transit. So these are big amounts of money that's going to fund significant projects to improve transportation and infrastructure in California. At the same time, it's also going to help our environment. In California, we're going to get $384 million to support the expansion of an EV charging network across our state. Also, $2.5 billion in grant funding dedicated to EV charging. With the infrastructure law, we're going to create jobs and at the same time make sure we have infrastructure for the 21st century, as well as infrastructure that is climate resilient and helps their environment. We're also now working on the Build Back Better Act, which will lower costs for Americans and improve the quality of life. It's going to lower prescription drug prices, lower elder care costs, and lower child care costs among the provisions in that bill. And we're also going to make sure that we continue to create jobs. Recent data came out showing that under the Biden administration, we actually hit the lowest jobless claims in over 50 years. That is very impressive, and we continue to make progress on growing our economy. At the same time, we are still in the middle of a pandemic, and with the Omicron variant, we are seeing some increasing spread of COVID, and I'm so honored to have with us Dr. Sion Roy, who will give us an update, and we're going to first of all hear a brief biography about Dr. Roy.
Yeah, thank you, Congressman. Dr. Sion Roy is a cardiologist and assistant professor of medicine at Harbor UCLA. Additionally, he serves as the director of the Inpatient Cardiac CT Program and Associate Cardiology Fellowship Program Director. He's the immediate past president of the LA County Medical Association and is also an elected trustee at Santa Monica College. Dr. Roy is a passionate advocate for increasing healthcare access for all. He serves as a trustee for the California Medical Association as well. Dr. Roy is active in the Santa Monica community and is passionate about increasing educational access for local students. He has served as the chair for the Santa Monica Malibu Unified School District Health and Safety Committee and vice chair for SMC's Bond Committee. Additionally, he is a past president of the Santa Monica Democratic Club and is elected delegate to the California Democratic Party from Assembly District 50. And again, we'll hear from him right here. If you have any questions for him, remember you can press 0 to get those to an operator. Dr. Roy, please update us with any information you'd like to share.
Thank you very much, and thank you to everybody for calling in. Thank you, Congressman Lieu, for your leadership throughout this pandemic. You've really led our district and in a way that we're all proud of. I do want to point out, I did this town hall with Congressman Lieu a year ago around this similar time, and we are in a much better spot than we were a year ago. A year ago, Los Angeles, particularly South LA, was really getting obliterated with COVID. Our area was as bad as anywhere in the world. And a year later, we've made a lot of progress in the vaccination effort. Our economy and society have, taken steps to getting back to normal. And so proud of how much progress that we've made over the past year. That being said, at this point, 75,000 Californians have died from COVID. 27,000 Angelenos have died from COVID. And we are seeing a slow rise in hospitalizations since Thanksgiving over the last, 15 days or so. We do have hospital capacity in LA County. And so we're not at rates that threaten ICU or hospital capacity, but cases are rising. And primarily, the hospitalizations continue to be among our unvaccinated population, but that's where the primary target is of the virus. 77% of Angelenos and 78% of Californians have been vaccinated who are 5 and up. And so we're above the national average. So our state and LA have done a great job in the vaccination effort, but we have more to go. The Omicron has been detected in California and in Southern California, and it is contributing to the rise in cases. Omicron appears to be more contagious than, perhaps more contagious than the Delta variant that has been so significant over the last several months throughout the world. And in terms of how lethal Omicron is comparatively to the other variants, that is yet to be known because we only have preliminary data. The good news is that preliminary studies show that the vaccines, particularly if you have a booster shot, your vaccine should be effective to a good degree against the Omicron variant. And so that's what the preliminary data shows. And so the biggest message still to Californians is to get vaccinated if you haven't been vaccinated, and if you've been vaccinated, to make sure that you get your booster shot. And so that's the biggest recommendation. And the last thing I wanted to comment on in my introductory remarks are the CDC came out with a report that has yet to be signed off by the director, but they are likely no longer going to recommend Johnson & Johnson vaccinations in the United States because of a risk of blood clotting events, increased risk comparatively to the mRNA vaccines, Moderna and Pfizer. And so those most Americans have gotten either Moderna or Pfizer, and those continue to be the workhorse vaccines for our country. But we're going to go away from Johnson & Johnson, it looks like. If you've gotten the Johnson & Johnson vaccine, it continues to be a recommendation that 2 months after to get boosted with an mRNA vaccine, and that should be equivalent. And so with that, I'll turn it back over to Congressman Lieu, and happy to stand for any questions.
Thank you so much, Dr. Roy, for that update. And we're happy to answer any questions that you may have, either about the infrastructure law or the pandemic or any other topic or issue that you're interested in.
Thank you so much, Congressman, and thank you again for being with us, Doctor. We'll go ahead and start Q&A now. And a reminder to those of you who'd like to get email updates from the Congressman's office, you can do that by pressing 7. At any time during this forum, speak to one of our operators, give them your best email address so we can keep you better updated on the issues that affect you moving forward. So again, 7 if you'd like to get email updates from the Congressman's office. We've got our first live question coming to us from Phyllis in Santa Monica. Phyllis, thank you for joining. What's your question?
Well, thank you very much. My question has to do with the pandemic, and I'm really curious to know how people who are vaccinated and have the booster contract this, especially this new one going around. I mean, what do you have to do to catch it? If you wear masks when you go places? I mean, I wear a mask. I just want to know, how do I keep as safe as possible, and under what conditions does one have to be in to catch this thing? Thank you.
Sure, and I'm happy to answer that question. If you've been vaccinated and boosted, that goes a long way towards protecting you against hospitalization or severe disease. That's where the vaccinations very much come into play. The vaccination also does mitigate against getting COVID and passing and transmitting COVID. But the biggest benefit of the vaccine is if you do get COVID on exposure, that you are much less likely than the general population to be hospitalized, get moderate or severe disease, or die from COVID. In terms of how do you protect yourself on top of the vaccination, California, the state has, reinstituted a statewide indoor mask mandate. And so if you are interacting with people inside, the recommendation would be to wear masks. That makes a difference in terms of decreasing transmission of the virus. And so, vaccinations and mask wearing continue to be the real stalwart defenses from getting and transmitting COVID.
Thank you so much. Very much appreciate that answer, Dr. Roy, and thank you to Phyllis for reaching out with that question. We've got Winifred and then Brian in line. Let's go to Winifred in Pacific Palisades next. Hey, Winifred, you're live. Go ahead.
Yes, I'm addressing this question to Mr. Lieu. My husband was a 100% disabled veteran, and I was living in Florida, and I had a VA loan, and my children moved to California, and I thought I should be near them since I'm 90 years old. And so I tried to sell my condo in Florida, but I was unsuccessful. So I just moved and I foreclosed on my condo. And I'm wondering if Mr. Lieu can help me to get a forgiveness on the VA loan so that I can buy a condo here or else a small 3-bedroom house. The condo I had was $128,000, and I had paid $10,000 on it before I foreclosed on it. And I received a mailing a few years ago saying that my condo had been sold by the bank for $1,000. So I'm wondering if I can get some help from Mr. Lieu to get a forgiveness on my VA loan so that I can either buy a condo, a 2-bedroom condo. I have a very small 1-bedroom apartment. It's 900 square feet, and I'm paying rent of close to $3,000 a month for the rent.
Got it, Winifred. All right, let's get Congressman Lieu in here to help answer this question for you. Thanks so much for reaching out.
So thank you for sharing your story and reaching out. My staff is on this call, and we will reach out to you. We do have a fantastic casework team in our district office. Even though we're in a pandemic, our district office staff continues to work every day remotely, and we're doing casework every single day. So we will reach out to you, and we will work on your case. And for anyone who's listening, if you have an issue with a federal agency, whether you need a passport because you realize yours is expiring and you're traveling in a week to a foreign country, or you're not getting your Social Security check, or any other issue with a federal agency, please contact our office at 323-651-1040, and we will assist you.
Thank you so much, Congressman. And Winifred, you can expect a call from the Congressman's office. We've got your contact information, so thanks for reaching out, and expect some help in the next few days. Thanks again. We're going to go to our next question live from Brian in Santa Monica. I did want to mention, for anybody who does need constituent assistance, and you can call the number the Congressman just mentioned. If you get to the end of the form and we don't answer your question, you can also leave a voicemail for his office just by staying on the line at the end. Brian, thanks for joining us. Go ahead with your question.
Good evening, everybody. And Congressman Lieu, I just want to start by saying that, like a lot of what I would call base Democrats, I really appreciate the passion that you're bringing to seeking justice in this country for all the wrongs that were committed, the crimes that were committed, and the treason that was committed during the Trump presidency. But it seems to me that the establishment Democratic Party is paying too much attention to things like Build Back Better. Yes, obviously the economy is extremely important in elections, but we're not going to have any straight up elections anymore, the way things are going. And I don't see the president, and I know you can't answer for him or make him do anything, but I don't see him doing anything more than paying superficial lip service to getting voting rights and restoration of the Voting Rights Act and things like that, the John Lewis Act, and none of that seems to be happening. We have Democratic holdouts and nobody's pitching hardballs at them. And so I guess that's more of a rant than a question, but I'd sure like to hear your thoughts on where you think this is headed. And I'm sure that you might share some of the frustration that you hear in my voice, because nobody's worked harder for this stuff than you have in Congress. And for that, again, I thank you. I think you're just doing a terrific job. And there we go. So if you could comment on that, I appreciate it. Thank you.
Thank you for your question. You're correct. I do share your frustration. In the House of Representatives, we have passed multiple times voting rights legislation to the U.S. Senate, and it's getting stuck there. Now, what we do know is that the Senate Democrats are making voting rights their priority right now, and they are trying to pass the Freedom to Vote Act. I hope they can do that. Since we're going to get basically no Republican support except for one Republican senator, Senator Murkowski, it does not look like that they're going to be able to pass that unless there's an exception to the filibuster. So they're working on seeing if Senators Manchin and Sinema would agree to that. It is very frustrating to not be able to pass legislation because of the filibuster. I hope the Senate will make an exception to the filibuster, because you're correct. Our democracy is under attack. The very essence of our nation as a constitutional republic is under attack. And if you don't have the freedom to vote, or if your vote is nullified by state legislatures, then essentially we no longer have a democracy. So we're pushing very hard on the voting rights issues. And separate and apart from that, I also believe the House of Representatives should invoke inherent contempt, which is a power that the Supreme Court has upheld in the past, that allows us to fine or even take other actions against witnesses who disobey congressional subpoenas. So I have legislation that would do that as well, and I'm trying to get the House to pass inherent contempt. So we just keep pushing, and we hope for the best.
Thanks again, Congressman. Appreciate you, Brian. Thanks for being a part of our forum tonight. We're going to go next to Alicia in Playa del Rey. Alicia, thanks for joining. What's your question for us? Alicia, we got you there on the line?
Hey there. I was wondering when the vaccine might be open for under 5-year-olds.
Got it. Dr. Roy, can you take this one for Alicia?
Sure. Yeah, no problem. That's a great question. I have a 4-year-old son, and we're itching for this as well. It's all speculative still at this point, but I expect, sometime early in the new year, most likely there will be an advisory and then saying that it's okay to vaccinate between 1 and 5, and then shortly after that, to have it, come to the market for that age group. But it's still speculative, unclear exactly when that's going to happen. But, I think it'll likely be in the first few months of the new year.
Perfect. Thanks so much. Thank you, Alicia. Thank you, Dr. Roy, for the answer. We're going to go right to Todd in Santa Monica next. And we'll have our first polling question after this. So folks will ask you to vote in a couple of polls tonight. We'd love your perspective on that. Todd in Santa Monica, you're live. Go ahead, sir.
Hello. Thank you for taking my question. Congressman Lieu, of the bills that you discussed at the beginning of the call, which of them has actually been signed into law? I've been really confused as someone who follows legislation and politics closely. Senator Manchin's recent pivot away sort of concerned me. So I'm not quite sure what is law, what has been signed into law by President Biden. If you could clarify that. Also, of the funds allocated for California that you mentioned, which are actually guaranteed to get to us and which have just been passed by Congress and are yet to reach the Senate for approval. And in closing, I'd just like to say Medicare for all. Thank you.
Thank you so much for your question. The president has set forth an agenda that has 3 bills. 2 of them are signed into law. The first was the American Rescue Plan, and that was earlier this year. That was designed to get us going again with the economy and to get vaccines out the door and into people's arms and put kids back into school. So the American Rescue Plan, for example, had stimulus checks in there that went to many American families. It had money for vaccine distribution and rollout. It had money for school districts so they can reopen safely. It had money to go to cities and states for their local first responders as they're dealing with pandemic issues. So that was a bill that, by the way, every Democrat voted for and every Republican voted against. I'm not trying to be partisan, it's just simply a fact. But that law had a big and dramatic effect on getting our economy going and having now over 5 million jobs created since January 20th. So that is law. The second piece of the president's agenda was infrastructure. That was also signed into law last month. And that is going to rebuild our nation's infrastructure as well as in California. So in addition to rebuilding roads, bridges, and highways, it's going to do EV charging stations. It's going to take lead out of our water. It's going to make sure we have a infrastructure network that's resilient or more resilient to climate change. And it's going to also create a lot of jobs. So that is also law. That law has significant amounts of funding, again, to California on top of the American Rescue Plan's funding. And that's going to be specific to infrastructure. So it's not all going to come at once. A lot of infrastructure projects are going to be spread out, for example, over 5 years. And one example is the $4.2 billion for bridge replacement. That's not going to come tomorrow. It's going to be spread out over 5 years, but it's still a significant amount of money over 5 years. So that is law. What is not yet law is something known as the Build Back Better Act. That bill is designed to improve the quality of life and to lower costs for Americans. So it's going to lower costs for prescription drugs. It's going to lower costs for elder care and also for child care, as well as extend the tax cut for families with children. That is not yet law. That's what you're seeing Senator Manchin and the White House work on. So that's where we are in terms of your question. And I also agree with you on Medicare for All. I am a co-author of that legislation as well.
Thank you, Congressman. Appreciate you again. And thank you to Todd for our last question. We are going to go to our next one from Robert in Redondo Beach, although Robert's asked me to read this one for him. He says, my son and I both had the J&J vaccine and J&J booster about a month ago. We just heard today from the CDC that the Pfizer and Moderna vaccines are better. Should we try to get a Pfizer or Moderna vaccine now? And Dr. Roy, I know you had some advice around this exact announcement made this morning. If you could take this one on for Robert.
Thank you for that question, Robert. That's a great question. And the advisories around the J&J vaccine have been confusing comparatively to the advisories around the mRNA vaccine. My advice would be for you and your son who have gotten the J&J vaccine and gotten boosted, there's nothing for you guys to do going forward. That vaccine continues to be effective against, people getting COVID and preventing hospitalizations, moderate and severe disease, and deaths. And so this advisory has nothing to do with its effectiveness against COVID. There's a small but significant increase in blood clots compared to the other two vaccinations, and that's where the advisory comes from. But almost, there almost certainly you will not be afflicted by that. Obviously keep out on lookout for symptoms, like lower extremity swelling or trouble breathing, but almost certainly you won't be afflicted by that. And so, there's no action for you to take as somebody who's gotten a J&J vaccine and a booster. For those of you who have gotten a J&J vaccine but haven't gotten boosted yet, as long as you're 2 months out from the J&J vaccine, the recommendation is to get either a Moderna or a Pfizer booster to supplement the J&J vaccine. So it's a great question, and the advisories around that vaccine have been confusing throughout the past year, but it's going to be slowly phased out. It's going to be phased out of the circulation this upcoming year, most likely.
Appreciate you. Thank you so much, Dr. Roy. And thanks, Robert. Great question. Glad you were able to ask that for us. We're going to go to our first polling question. We're at the halfway mark of our forum, so I'll remind you, if you want to get email updates from Congressman Lieu, you can press 7 on your phone. Give your best email to an operator, and they'll be able to add you to the email update list to keep you updated moving forward. So 7 for email updates. And our question for you is this. What kinds of investments are you most excited to see thanks to the bipartisan infrastructure law? Press 1 for roads, bridges, and transit. Press 2 for green infrastructure, EV charging, and clean energy programs. Press 3 for access to broadband, and press 4 for good-paying, quality jobs. So again, we're wondering what kinds of investments are you most excited to see thanks to the bipartisan infrastructure law. Press 1 for roads, bridges, and transit. Press 2 for green infrastructure like EV charging and clean energy programs. Press 3 for access to broadband internet, and press 4 for good-paying, quality jobs. Go ahead and vote now. We'll have one more poll before we get to the end of our forum, so thanks again to everybody who voted in that. That's a great way to give us some feedback, and we'll keep going through Q&A until the very end of our forum. One more reminder again that when we get to the end of our forum, if you don't have your question answered or if you need constituent assistance from the Congressman's office, all you have to do is stay on the line at the end to leave a voicemail message with your name, contact info, and question or concern, so that his office can give you a call back in the next couple of days. Let's go to Clydeen and Marina Del Rey for our next question. Clydeen, you're live. Go ahead, please.
Yes, thanks, almost said Dr. Lieu, for taking my call. Everything's happening here at the same time. My concerns are about disabled and elderly people are not being considered, with businesses, including government agencies, when they're instituting some type of program or something to participate in. They're telling everybody to do it by on the internet. A large segment of the population does not have computers, can't afford the internet, so they're not able to participate in the programs or do whatever is necessary. So I would like to see, starting with the federal government and local governments, to mandate that all businesses, government agencies, whatever, to offer more than one choice other than just using the internet, so they can accommodate everyone. My other concern is with the COVID rules, regulation, laws, and so forth, mandates that are out there. Many of them, elderly people and disabled people, again, have problems being able to participate. And when you ask for an accommodation, the business says, well, this is what the COVID rule says or the mandate says or whatever, and we don't have to do that. And when you tell them the ADA still exists and you have to accommodate people with disabilities, they said, no, we don't, because COVID doesn't say that. The rule doesn't say that. So we need to have something, a language within these COVID rules and mandates that specifically say that they still have to abide by the ADA and civil rights laws.
Thank you for the points you made, both of them. They're good points. And you're absolutely correct that the American with Disabilities Act's reasonable accommodations provision is still the law of the land. And anyone that's not doing that is in violation of ADA. And if there's a specific issue related to you, we can assist you with that, and I'll have my casework team reach out to you. Also, regarding the internet, it is correct that a number of folks, particularly low income, may not have access to the internet. If you are having specific issues related to you in trying to fill out a form or something that requires the internet, again, let our office know, and I'll also have my casework team reach out to you to see if we can assist you. I do want to note that the infrastructure law recognizes that problem, and so there's funding in there that's going to help over 10 million people in California connect to the internet with funding that's going to apply to about 27% of Californians who are low income and make sure that they can afford internet access. And hopefully we can get the state to also match some of that funding as well. So it is definitely an issue, and we are trying to address that at both the federal and state levels.
Appreciate that answer. Thank you very much, Congressman. Thank you, Clyde Dean. And as the Congressman mentioned, he'll have his office follow up with you in the next few days. So thanks again for reaching out for help. Congressman, we're going to go to John next, and then we'll have the results of our first poll after we take John's question. John in L.A., thanks for joining. Go ahead.
Hello, Congressman. Say, I watched your whole presentation at the impeachments, and I'm very proud of your presentations. I know you're a prosecutor. My problem as a lawyer is when I watch what's going on with the subpoenas for Congress and persons who refuse to comply, I'm wondering why it takes so long and why it's so deliberative a process for Congress to issue a contempt citation. I mean, as a lawyer, I find it reprehensible that persons can simply ignore subpoenas, which are duly enforced under criminal sanctions, and then it takes Congress a day, a week, a month to figure out whether or not to send this for indictment. I know that you're not a party to that delay. I'm just kind of encouraging you to keep the rod on these congressmen who are. And we're out here in Never Never Land just watching what happens with these people who refuse to comply. And we wonder, well, you know, people get picked up off the street all the time for minor offenses, and they're rushed through the criminal system. And here are our officials, our public officials, just gaming the system. I wonder if you have a comment about that. Thank you.
I do have a comment about that. I have lots of comments, actually. I agree with you. The system is far too slow. And what we learned during the administration of the former president is that people were able to essentially litigate and delay the subpoenas to a point that they essentially became meaningless. So I'll give you a good example. I'm on the House Judiciary Committee. We issued a subpoena to Don McGahn, their former White House counsel, and he basically ignored it and said he wasn't going to comply with it, and then it went into litigation. Eventually, we won the case, but it took over 2 years. And so at that point, it basically essentially became meaningless because no one cared about the issues anymore 2 years later. And we're seeing a similar problem now. So, for example, with regards to Steve Bannon, who's choosing to ignore a subpoena from the January 6th committee, the House of Representatives did, in fact, hold him in contempt. And we actually did do it fairly quickly. The problem is the judge has set a trial date for August of next year. So by the time that trial is concluded and he appeals it, and then the appellate court decides, and then that gets appealed to the Supreme Court, it's going to be, more than a year later. And so to me, that's just unacceptable. So I have introduced legislation in the House to allow us to invoke our inherent contempt power, which, again, the Supreme Court has upheld and allows us to enforce our own subpoenas. We could put people into detention. We could fine them money. And this is what Congress used to do in the past. This way, a litigant can't just delay a subpoena for over 2 years and try to run out the clock. The good news about this legislation is it's just a House rules change. We don't need the Senate to agree. We don't need the executive branch to sign this law. We simply need the House of Representatives to pass it by a majority vote. And so I've been pushing for that, and my hope is we will be able to get that done.
Thank you, Congressman. Appreciate you being on, John. Great question, and thank you for asking it. We're going to go to the results of our poll. Then we've got William in Rolling Hills Estates live. Next, Congressman, here's the results of our poll, and I'd love to hear your thoughts on this as well. We asked what kinds of investments are you most excited to see thanks to the bipartisan infrastructure law. We have 38% of our vote saying roads, bridges, and transit, 34% saying green infrastructure like EV charging and clean energy programs, 23% saying good paying quality jobs, and 5% saying it's that new access to broadband internet. What are your thoughts on the results of that poll?
That's very helpful to know. It's interesting to compare the results of this poll with one we did last week on a Facebook Live town hall where it was overwhelming in terms of EV charging in the environment. So it is interesting to compare and contrast the two polls. But in this case, the EV charging came in a close second. But I also understand that getting roads, bridges, and highways fixed and repaired and making sure that we reduce the number of potholes and the number of unsafe bridges is also critically important. The good news is the infrastructure law actually does all of that. We just have to make sure that it gets expedited in California, and to get the state to put up matching funds, which would then essentially multiply the effect of the money and leverage it for even more projects. So I do appreciate the input for the poll.
Excellent. Thank you again. And again, we will have one more poll before the end, folks. We have about 18 minutes left in this live forum. So if you wanted to get email updates from the congressman, please press 7 before we get to the end of your call. We won't be able to collect that email after we get to the end, although you can go to his website at lieu.house.gov to sign up for emails as well. If you want to get it done on this call, though, please press 7 now, speak to an operator, and give them your best email. We also just cleared the queue of those who were submitting questions for Q&A. So if you want to submit a late question here, feel free to press 0 and give your question to an operator. William, as promised, in Rolling Hills Estates, welcome to the call, and what's your question for us?
Thank you very much. Thank you very much. This question is for Congressman Lieu. Congressman Lieu, with the Build Back Better bill just being passed, who determines where those funds will be spent in the state of California, and how do you assure the taxpayers they're going to be spent in a pragmatic way?
Thank you for that question. So just to clarify, it has passed the House of Representatives. It has not passed the U.S. Senate yet. So the Build Back Better Act is not yet law. Now, specifically, your question as to how the funds are allocated, it does vary by the program. Some of them are based simply on straight-up criteria that every American either will meet or not meet. So, for example, the Build Back Better Act that passed the House will extend the tax credit for families with children. To qualify for that tax credit, first of all, you have to be a family that has children, and the children have to be under 18. And then depending on your family's income level, you're either going to qualify or you're not. And so that is an example where it's simply a program just based on criteria that applies across the board. There's also going to be certain funds that are allocated to states that the states will then distribute. Then there are going to be other programs that are going to be sort of need-based, again, based on income qualifying level. So it does sort of depend specifically on the provision. And then there are going to be some programs that are just going to provide an additional new benefit to Americans. So, for example, it's going to fund universal preschool. So under the Build Back Better Act, essentially, we're going to have universal preschool for 3 and 4 year old kids. So if you got a 3 or 4 year old child, when this is implemented, actually your current 3 or 4 year child will be too old by that time. But if you have a newborn or a younger child, then by the time this is implemented, they will be able to access universal preschool. So it is very dependent on the specific provision in a specific program in the Build Back Better Act.
Got it. Thank you again. Appreciate you, Congressman. Thank you, William. Appreciate your question very much. Thanks to you. We've got Elle up next in Santa Monica. She has asked me to read her question for you, Congressman. She says, how contagious is a person who has been vaccinated? Can you transmit the virus to unvaccinated people? And maybe Dr. Roy, can you take this one on for Elle in Santa Monica?
Yes. So vaccinated people can certainly transmit the virus, but it does make vaccinated folks transmit the virus to a much lower degree than unvaccinated folks do. And then similarly, in terms of catching COVID, you're less likely to do it as a vaccinated person than unvaccinated person. And so really the least likely way to spread is, vaccinated people hanging out with vaccinated people. That's the lowest likelihood of spreading. And then the more unvaccinated people that you have in a group, the more likely that it is to spread. And so, again, the message for all of this is to get vaccinated.
Yep. Thank you. Appreciate that answer. Thanks so much, Doctor. And thanks for that last question from Elle in Santa Monica. We've got Dana and then Brenda up live with questions next. But first, we want to run a poll question for you. It's our second and final poll, so get ready to vote. I'll go ahead and read through both options twice again. What matters most to you when it comes to green infrastructure? Press 1 if it's money for expansion of electric vehicle charging networks. Press 2 if it's more electric school buses. Press 3 if it's improvements to an expansion of public transportation systems. So again, what matters most to you when it comes to green infrastructure improvements? Press 1 for money for expansion of electric vehicle charging networks. Press 2 for more electric school buses. Press 3 for improvements to an expansion of public transportation systems. Go ahead and vote now. We'll have the results of that after a couple of more questions. Let's go ahead and get Dana in LA up live next. Dana, thanks for waiting. Go ahead.
Oh, thank you. This is a slightly maybe quixotic question. I'm one of those nail biters who's losing sleep over voting rights and the BBB, Build Back Better, and I'm just wondering, my wonderful, wonderful congressman, is there any way you can do something about making a Senate and Congress not take a break until both are passed? That's my question.
Thank you very much for that question. I don't pretend to understand how the U.S. Senate works. They are mysterious and arcane to me. They have really strange procedural rules. Individual senators have immense amounts of power to simply hold things up. My understanding is that the Senate Democratic Caucus has chosen as of this moment to focus on voting rights. I don't really understand why they can't walk and chew gum at the same time and do two big things at the same time, but apparently they're unable to do that. So right now they're trying to get voting rights legislation passed. And there is a time element to that. So I can understand why they're choosing to do this, because at some point the gerrymandering in terms of how a lot of these districts have been drawn, especially in these red states, it'll be too late to reverse for the upcoming election cycle. So if you're going to make sure that we don't have extreme gerrymandering and unfair districts, then we're going to have to pass the Freedom of Vote Act relatively soon for it to be able to work for this upcoming election cycle. But my view is they should do both. They should, work on voting rights legislation and work on the Build Back Better Act. It's not exactly clear to me why they can't do two things simultaneously, but apparently they can't. So my understanding is Senator Schumer has chosen to, as of this exact moment, work on voting rights legislation. So my hope is they can get that passed and then pass the Build Back Better Act very soon.
Thank you again. Appreciate that answer. And thanks so much, Dana, for being a part of our forum. Really great question there. Let's go to our results from our last poll question after our next question from Brenda in LA. Brenda, thank you for waiting. You're live on the line with the Congressman. What's your question?
Thank you so much. With the dangers of Omicron spreading in so many countries in the world, I was wondering what are the current travel advisories about travel within the U.S., to Canada, or overseas? What is recommended currently?
Dr. Roy or Congressman Lieu, either of you have any updates on travel recommendations here?
I can take that. I mean, increasing, traveling by plane definitely increases your risk of getting Omicron or another COVID variant. And so, international travel, particularly, I would be careful over the holiday season, over the winter, when transmissibility is going to be at its greatest. And then additionally, Omicron is here in the United States, and so getting on an airplane increases your risk of getting Omicron. All of this is risk mitigation, and so if you want to really optimize the conditions where you aren't exposed to COVID or aren't exposed to Omicron, then not decreasing air travel would be recommended.
And the State Department has an official list of countries and the travel advisories for various countries. So if you go to travel.state.gov, you can see that. So again, it's travel.state.gov. And I agree with Dr. Roy that it's all about risk mitigation. But in addition to what our State Department has issued in terms of travel advisories, different countries have their own requirements. So, for example, some countries will make you quarantine for 2 weeks if you go there before they let you go to other parts of the country, or they may have additional requirements. So you need to look at every country specifically if you're looking at traveling there.
Thanks to both of you. Great answers. Thank you, Brenda, for reaching out with this question and concern. And folks, we've got about 7 minutes left, so I'm going to read the results of this poll here and ask Congressman Lieu for his feedback. We asked you what matters most to you when it comes to green infrastructure. 57% of you said it was improvements to an expansion of public transportation systems. 34% of you said it was money for expansion of electric vehicle charging networks, and then we had 9% who said it was more electric school buses. So thanks for the feedback on that, Congressman. Any thoughts on these results?
Yeah. It's very helpful to know that, and the good news is the infrastructure law, of those three items, the biggest pot of money is, in fact, for public transportation. It's $9.45 billion to California over 5 years for public transportation improvements. That is a pretty big figure. And when you then add in state and local matching funds, that is a lot of money to improve public transportation. And we sorely need it in LA County especially to improve public transportation.
Appreciate that feedback, and thank you again, everybody who voted in those polls. Really appreciate your perspective tonight. We're going to start wrapping up here. I'm going to give the Congressman a few minutes to offer any closing thoughts he may have in just a moment here, but I wanted to remind you, if you didn't get a chance to sign up for email updates tonight, you can go to lieu.house.gov and sign up and get more information on the work the Congressman is doing there. You can reach out to the Los Angeles District Office if you need constituent assistance at 323-651-1040, or by staying on the line here as we wrap up, you'll automatically go to our voicemail system if you stay on the call after we close, and you can leave a voicemail message for Congressman Lieu's staff with your name, your phone number, and whatever your question or concern is, and they can follow back up with you in the next few days. I did want to say Winifred, Linda, Clydine, and Leon, we've already got you folks tagged for follow-up, so thanks to those of you who reached out for assistance from our operators tonight. And with that, I'll turn it back over to Congressman Lieu to take us to the close.
Again, I want to thank everyone for participating in this town hall. And just to recap, 2 of the 3 bills of the President's agenda are now law. The American Rescue Plan was accomplished earlier this year, and that helped put kids back into schools. It helped get vaccines into people's arms. It got stimulus checks to American families, and it got over 5 million people now back to work. We then followed that up with the infrastructure law, and earlier in this call, I provided the amounts of funding for roads and bridges and highways, as well as for EV charging and public transit. I want to provide additional funding for other parts of infrastructure. So California is also going to get $3.5 billion over 5 years to improve water infrastructure across our state and make sure that we have clean, safe drinking water everywhere in California. We're also going to get $84 million to protect against wildfires, and that's very important to my district as well. It was only a few years ago that we had major wildfires in the northern part of my district. And we're also going to get $40 million to protect against cyber attacks. I've long been championing infrastructure as one for the 21st century, which means we have to make our infrastructure also resilient to hackers and cyber attacks. Also, it's very clear that we are much better now than we were a year ago. And Dr. Roy is absolutely right. Even though we do have the Omicron variant, we are still in a much better position. Many more people are now vaccinated. We've got kids back into schools. We have our economy growing. The Dow is up. We've got additional ways to treat this virus. And we also have additional products coming online, including a pill that you can take if you do have COVID, that at least in the preliminary trial shows to be pretty effective. So we continue to see ways to attack this virus and to mitigate its spread. And again, if any of you have not yet gotten your booster shot, please go get a booster shot. And if you're not yet vaccinated, please talk to your doctor about getting vaccinated. Or if you don't have a doctor, read what doctor organizations like the American Medical Association have said about vaccines. Or just listen to Dr. Roy, who's been splendid tonight. And with that, I'll turn it over to Dr. Roy.
Thank you, Congressman Lieu, and thank you to everybody tuning in. I just want 2 points. One is, as you've mentioned, we are in such a better place than we were last winter, and hopefully next winter, if we do a call like this, we'll be talking about really the end of COVID. And so the 1918 pandemic lasted 3 years with 4 separate surges. And obviously the conditions are a little bit different with vaccination deployment, but we're, entering year 3 here, and hopefully we're really reaching a phase where we'll be able to see the light at the end of the tunnel. Just to echo your encouragement, if you haven't gotten the vaccination, please get vaccinated to protect yourself and your family and your community. And if you've gotten vaccinated, as 80% of Angelinos have, please get boosted if you haven't already. Thank you.
Appreciate you, Doctor. And thank you again, Congressman, for organizing this event tonight. We really appreciate California's 33rd Congressional District for joining us. We'll wrap it up here. Again, if you need additional constituent assistance from Congressman Lieu's office, stay on the line, leave a voicemail message with your question or concern, your name, and your phone number, and they'll reach out to you in the next few days. Appreciate everybody joining us. Thank you again. Be well. Have a great night.